Here's something that doesn't make sense to me. We are the most therapeutically aware generation in human history. We talk about mental health constantly. We diagnose early. We intervene fast. It starts in the school system, early days of K-12. And yet, kids today are more anxious, they're more depressed, they're more fragile than ever before. And here's a stat that should stop you in your tracks. 1 in 6 American children between the ages of 8 and 2 now has a diagnosed mental, behavioral, or developmental disorder. 1 in 6. And that's from Abigail Schreier's book, Bad Therapy. Very solid research. Jonathan Haidt has great research on this. He points out that Gen Z is spending less time with friends, more time in therapy than any previous generation. Youth suicide is climbing despite this explosion in diagnoses and treatment. So what's happening? Well, I think we're making two opposite mistakes at the same time. First, we're over-treating normal childhood struggles. Every tantrum gets a label. Every rough patch is diagnosed. We're teaching kids that they're fragile when they really need to learn how to be more resilient. And maybe other generations have over-indexed on that, but this last round is definitely under-indexed on resilience building. Haidt talks about removing all the risk and discomfort from childhood and how that's really not helped our kids. I would agree. We've created a generation, and probably in 2 generations, but solidly a generation, maybe a generation and a half of kids who just don't know how to handle sitting with anxiety and letting that be a part of their existence. Okay, so here's the second mistake as I see it. Well, we're overdiagnosing normal struggles. We're undertreating actual mental health crises, people who genuinely can't function and need some help to get out of the collapse that they're in. They're overwhelmed. And so one bugaboo for me, let's talk about the casual use of the term PTSD, terms like that are casually used, post-traumatic stress. I can tell you who really has PTSD. War veterans, the person who's come in to me to get therapy for being sexually abused by her father repeatedly, that is somebody who has PTSD. The anxiety, even if it was debilitating from your last math exam or the really bad manager you had, this is not PTSD worthy. And see, when you use clinical terms casually like this, you diminish actual disorders and it confuses normal stress with real genuine trauma. And this is now showing up and has for some time in the workplace. And if you're a leader, you'll recognize this. You are probably finding yourselves having to train younger workers on what counts as oversharing. The be your authentic self at work advice is terrible advice. Make your mental health your number one priority is terrible advice. It sounds compassionate, but mostly it ends up paralyzing people. It turns every struggle into an identity that requires, of course, an accommodation. And so the real issue is this. Normal human struggling is not the same thing as actual mental illness. Most people don't need therapy. They need resilience training. They need building a world and a sense of self that can tolerate the normal ups and downs and know what abnormal ups or downs really is. They need to learn that discomfort is not trauma. But some people really do need psychiatric or psychologic intervention. And right now, we're just really doing neither of these things all that well. So what do? Well, I think first we restore the perspective that we need. We stop labeling every hard moment or event in life. We stop treating discomfort like it's dangerous. And then next, we rebuild boundaries, especially at work. The workplace is not your therapist, neither is your boss. Mental health matters, but so does just showing up, even through a lot of that. And third, we save resources for people in real crisis. And you believe them when they come in and tell you, but you ask some good questions to figure out whether that's indeed the case. So when someone genuinely can't function, believe them, help them, but also ask some good questions. Stop medicalizing everyone's Monday mood, though. And listen, we've created a world where everyone is a patient and no one actually gets help. So maybe the most radical thing we could do is to trust that most people are actually capable. Stop treating resilience like pathology and start treating actual mental illness like it matters.